bring him in, my good friend. He's been part of this morning show over 25 years. Great insight into the world of sports, sports medicine, and really our young athletes. That's my good friend, Dr. Joe Congini from Sports Medicine Center at Akron Children's Hospital. And Dr. Joe, what do you have for us today?
Well, today, Ray, unfortunately, I think, I want to just mention a few things as a jumping off point, and just can't ignore probably our region of the country's most favorite athlete, most inspiring athlete, most respected, and the topic of conversation, of course, would be Nick Chubb. We've all kind of seen as he's struggled to kind of get back to full form from that devastating injury last year. What a wonderful athlete. He does everything right. He was working hard, but you could tell he was not back all the way from the knee injury. And then this week, on top of it, he gets a foot fracture. Throughout the reading a lot, trying to find out exactly what bone in the foot it is to figure out what type of fracture. Nobody's really saying this early in the week. We'll see kind of if he ends up going to surgery or not. We talk here, and we educate your audience. There's such a great audience you have. We talk about stress fractures of the foot, odd fractures called Liz Frank fractures, which occur in athletes occasionally, avulsion fractures where the tendon pulls off a piece of the bone. The most common fracture is probably a Jones fracture, and a couple times a year, you just hope for your home teams that it's not, and Jones fractures occur in high school athletes, college athletes. You just hope that it doesn't come at a time that's really critical, because Jones fractures heal pretty well, and most people out there are speculating that Nick Chubb's injury was a Jones fracture. They call it a non-contact type fracture on the outside part of the foot, and this Jones fracture has really a pretty good outcome, but it usually does require surgery. So we'll watch over the next few days and weeks whether they say he needs a surgery on it, but Jones fractures heal pretty quickly and pretty full recovery. Of course, in our memory bank of Cleveland history of sports, we have one that came at a terrible time, just before the NBA semifinals in 1976, the famous Jones fracture that stopped Jim Jones from playing, and the Cavs were on their way to a championship, the Miracle team, and ended up losing to the Celtics. But I want to talk just a little bit about foot today, Ray, just a couple of interesting tidbits about it. The foot has 26 bones in the foot, and with 2 feet, that's 52 bones. We only have 206 bones, so 52 is about 25% of, about a quarter of the bones in the whole body are in the foot. Many of them are smaller bones. Lots of sports injuries here. Really, the foot, what we do, we talk about 3 regions of the foot when we talk about injuries. The front of the foot, we call it the forefoot, has the toes, 14 bones in the toes. Rarely a major issue in sports unless it's the big toe. Occasionally we'll get a major issue there. But in the middle of the foot are the midfoot are called metatarsal bones. There's 5 of those. That's where most injuries occur. That's kind of the push-off area where the foot bends and pushes off in sports a lot. And so the metatarsals are real common, particularly the one on the outside is the 5th metatarsal, the Jones fracture we were talking about earlier. And then as you get closer back toward the lower ankle and the back of the foot, there's 7 bones back there. The calcaneus bone is the heel bone, and that is involved with injury quite frequently. In the middle of the foot is a bone called the talus that we look at a lot. So the foot is, 25% of bones in the body, some of them really small and others not so much. They all are treated very differently. And thankfully, there's so many tendons and ligaments and that plantar fascia that helps absorb the shock in the foot, or we'd have even more foot injuries. But foot injuries are pretty common in sports. And, you see them treated with crutches and boots and casts and surgery in some situations. The big deal is timing. They can really derail your sports team's dreams when they come at bad times. And so this injury to Nick Chubb, we don't know exactly which bone it is. 25% of injuries will be in the foot. So as we've wound our way back and forth through the sports year this year, and we're coming to the end of the sports year, we end up at the bottom of the foot for the last injury that we talked about today is down at the foot. But I really wanted to take a moment to to wish you and your family, your beautiful family, a great holiday, Ray. And we'll talk again in 2025. But any questions or anything in your mind about foot injuries?
I did, Joe. It was really an intensive rehab for Nick Chubb. And I was just wondering, through your experience in sports medicine, when a player is rehabbing from a certain injury, whether it be an arm injury, knee, foot, whatever that might be, ankle injury, do you see from the sports medicine standpoint that other parts of that area get affected and the injuries occur? If I'm rehabbing that knee really, really hard, do you see an ankle or foot injury from that person just because of the wear and tear and the vigorous rehab that player or that person has done in the last year?
Yeah. Hey, Ray, do you have a little bit of extra time? You want to join our staff down at the Sports Medicine Center? Because you always ask the very most insightful questions. And it really was something that right away on Sunday night I was thinking to myself, knowing how hard he works, knowing and seeing the pictures of him in the weight room, and knowing that, oh, my gosh, he just lives in the weight room, and that's how he gets to be so explosive. Never got all of his explosion back. But in many, many athletes, they spend so much time in the weight room, and I know it's going to be the hardest thing is probably going to be because of the foot not being in the weight room. But, yes, the answer is yes. Yes, I definitely do see that other injuries can be related once we head down the road and we end up really trying to favor a certain area and other things that come up. There's no question that we will sometimes see a pattern of injuries the injury bugs start to bite people and in different areas. And so I would believe in a situation like this, yes, there could be some situation, some issue and some component of this that is related to how hard he's working to try to get that knee back to 100%. That's a great question, right?
All right, my friend. Well, listen, same to you and that wonderful family of yours, Joe. Have a great holiday season. Looking forward to our conversations in January and all of 2025. Thank you for making time for us each week here on the morning show.
Thanks, Ray. Have a great, great holiday, okay?
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. As I mentioned, he's been part of this morning show on WAKR for over 25 years for the